see the Alcona Health Center PXP portal, which stands for Patient Experience Platform Portal. This is your login screen. When you receive the electronic invite, you will set up a username and password and link your electronic health record to our patient portal. Once you have set up your username and password, you will then click Sign In. And from here, you will see the home page. On the left-hand side, you see the icon options, which are very similar to the home page. And I will review the different functions and features of these icons. The first one is Messages. When you click on Messages, you have the ability to view Inbox, which are messages that are sent from our health center to our patients. You then have the ability to view Sent, which are messages sent from our patient to our health center. Then any archived, which would be deleted. This works very similar to email, however, it is secure. You also have the ability to ask a question. The Ask a Question button will pop up 4 different questions and route to the appropriate staff member that needs to be reviewing. You have the ability to ask a billing question, ask a general office question, ask a provider team or care team a question, and ask a referral question. From the homepage, you also have the ability to view appointments. This will show you upcoming appointments, past appointments, and any previous requests that you have requested. The Ask a Question button also populates those same 4 questions. You have the ability to review medications. This will show you your active and inactive medications. You also have the ability to review your health record, which will show any clinical summaries that from encounters that you had with your patient or your care team. It will show your medications, problems, allergies, social, and past medical history. And from here, you have the ability to view individual encounters. You can also share, download, and print. The last icon that you see here is our patient education. This is a new feature that allows for you to obtain education in regards to a newly diagnosed diagnosis or a new medication. If you click Launch My Education, it will allow you to enter key search terms to populate the appropriate option, or you can select from the topics and tools listed below. So if I wanted to look up an asthma condition or diagnosis, I can select on the education handout that's appropriate to me, and I would be able to see the tools and material that were pertinent to that diagnosis or treatment. When you're finished with that, you can exit out of it and it takes you back to the home page. Now I would like to demonstrate some of these icons and how to function and request information from your health center. The first one was Messages, which both had the Ask a Question icon. These work very similar. So if I click on Ask a Question and I want to ask a general office question, we ask that if you're experiencing a medical emergency, you please dial 911 or your local emergency number for immediate assistance. If this is a non-emergency, you may continue with sending your message. I will demonstrate a test message for you. So you will type in your subject and then you'll select your primary care provider. You will then ask your question. Once you are finished, you can click Continue. And then you have the summary of your question. It will then let you know, thank you for submitting your question. Our practice will review your question and respond. Another feature is requesting an appointment. To request an appointment, you can click on the green link, and it wants to know your location and provider. However, same goes here. If you are experiencing a medical emergency, please dial 911 for immediate assistance. Also, if you need same-day appointments, we ask that you call our office because we would like to speak with you directly and get you in as soon as possible. I'm going to go ahead and continue with selecting my location and my primary care provider, and then I can click continue. You can specify your appointment information. So you can choose to select first available, or you can say just early morning or late afternoon on Monday, Wednesdays, Fridays, and any week. It could be this week or next week. And then it is important to enter your reason for your visit. So this patient is going to come in for a medication review. Then I am going to request my appointment. It will then tell you that your request went through successfully for an appointment with Dr. Bashira at the Alpena Services, and that our practice will review and respond by email to confirm your appointment date and time. Another feature that's beneficial for you is medications. You can select a request for a medication refill by clicking on the RX request. Again, choosing your location and your provider, selecting your pharmacy that you would like the prescription to be refilled to. If it is not listed, you have the ability to add it, and then click continue. Then you will select the medication you're looking to refill based off the medication list, and you will confirm your renewal details. This text box is for any additional comments or notes that you would like to provide to the care team. Once you are finished, you can click confirm. This will let you know that your message for your prescription request has been submitted and that our practice will process. We do ask that you give us the 72-hour requirement in order to ensure that it is at your pharmacy. Another thing to mention with medication refill request is to always check with your pharmacy first to see if you have any prescription refills left on the previous script. The last feature that I would like to show you is Account. Under Account, you have the ability to view and invite new people to your portal. So if you would like to give a trusted representative access to your portal, you can click Invite New and send them a link to their email. If you want to edit your patient account, you can click on Edit next to your name or an individual, and you can review your profile options as well as security options, your preferred pharmacy, and you can view account activity. Any changes that you make in regards to preferred pharmacy and demographics will go to our front office staff to be processed before updating in your health record. Once you are finished, you have the ability to log out to ensure that you do not stay logged into the portal. Another feature here on the bottom right-hand side is our website for our health centers, as well as any social media links that we have.